Dr. Ferguson, what is gestational diabetes?
Gestational diabetes is diabetes that occurs during pregnancy. It's essentially looking at your body's ability to regulate blood sugar under stress. So
The stress of being pregnant.
So when you're pregnant, your body is under increased stress. Your ability to regulate blood sugar can be impaired. And interestingly enough, looking at your body under stress when you're pregnant can be a snapshot of what your body will do later on in aging. So similar to stress, aging on the body. So women who have gestational diabetes are at increased risk for developing type 2 diabetes later in life as well. So it can be a little warning signal for women as well.
Does it go away after the pregnancy?
Generally, yeah. Generally it clears with the end of the pregnancy. But again, it's a warning for for you later in life that you could be at risk for diabetes. It is, some of the well-known risk factors are certainly diet and lifestyle. So that high glycemic index diet, simple sugars, excess weight are things that will put you at greater risk for developing gestational diabetes.
And you're going to be craving, or often women will crave more sweets when they are pregnant, right?
Yep, so that can be difficult.
And could that be because there's blood sugar irregularities?
So one of the sort of vicious cycles that can occur with diabetes is that there's dysregulation in blood sugar, meaning that your blood sugar goes too high, which spikes your insulin, which plummets your blood sugar, which means that your body needs blood sugar to operate, so you crave the sweets again, which spikes your insulin again and drops. So you have this up and down type of feeling and thing going on in your blood.
Does that affect the baby?
The main ways that affects the baby is actually more towards the end of pregnancy. You're at greater risk for your baby being overweight, so being a little bit more chubby, harder to get out, and then also more at risk for your baby to have blood sugar regulation problems right after birth. It's generally not as much of a long-term thing that you see in babies, but right after birth they can be a bit more jittery and more sensitive to blood sugar changes.
So have you ever worked with women who have gestational diabetes?
Yes, I've helped a number of women who have been diagnosed with gestational diabetes.
And you took them off the sugar right away.
Yeah, that's a big part, is breaking that vicious sugar cycle, up-down sugar cycle.
It's not easy.
It isn't. It takes a lot of commitment on their part, but most mothers, in my experience, are willing to make those diet changes for their baby's health and for their own health too. I've seen, in fact, worked with women who've had gestational diabetes with prior pregnancies that are now on a consecutive pregnancy and would like to avoid that. So working with them to make lifestyle changes is a big part of that, and it can absolutely help regulate your blood sugar during pregnancy and after. Again, that's going to involve real, regular meals, not going longer than 3 hours without food, making sure that there's a protein source at each of those meals and snacks is going to be really important. And then eliminating those high glycemic index foods, which include your simple sugars, refined flour products, things like that.
All right. Thank you.